Hello, my name is Janet Sartain. I'm a senior nursing student at Indiana State University's LPN to BSN completion program. These educational videos are being produced in lieu of face-to-face clinical hours for my Nursing 444 Community Health Nursing class. This week, the presentation is on stroke. We'll look at some of the risks, the preventions, diagnosis and treatment of strokes. Learning objectives for this video. Following the presentation, the learner will be able to list the types of strokes, identify signs and symptoms of a stroke, list risk factors for a stroke, both modifiable and non-modifiable, name emergency treatment when a stroke is suspected. This is a pretest just to kind of gauge how much you might know before the video. If you want to pause for just a minute and answer those, we'll go over the answers at the end of the video. What is a stroke? A stroke is also known as a cerebrovascular accident, and it can occur when the blood supply to a part of the brain has been interrupted or reduced. This causes the brain to not get enough oxygen and nutrients, and the brain cells will begin to die. A stroke is it's an urgent situation. It's a medical emergency, and quick treatment is crucial to recovery and survival. There are several types of strokes. We're going to just talk about the ischemic stroke. An ischemic stroke happens when the blood supply to the brain is blocked, usually with a clot. If there is a clot in a blood vessel in the brain, it prevents blood and nutrients from getting to that area of the brain. Then that area of the brain will suffer tissue death. There's also a hemorrhagic stroke. A hemorrhagic stroke happens when a blood vessel in the brain bursts and the blood for that area of the brain cannot get there, thereby compromising the oxygen supply to the brain and again causing tissue death. Some of the signs and symptoms of a stroke. If you experience sudden numbness or weakness in the face, arm, or leg, most especially on one side of the body. You're suddenly confused, have trouble speaking, or difficulty understanding others' speech. You have trouble seeing in one or both eyes, trouble walking due to dizziness, loss of balance, or lack of coordination, or possibly a severe headache with no known cause. An acronym for helping remember how to diagnose or determine if a patient is having a suspected stroke is to act fast. FAST is your acronym. F is for face. You're going to ask the person to smile. Does one side of their face droop? Does one side of the smile go up and the other one just not move? That's a pretty good indicator that something's going on and the patient could possibly have a stroke. A is for arms. You ask the person to raise both arms. Are they able to hold them up and steady, or does one arm tend to drift downward? Speech. Ask the patient to repeat a simple phrase. Does the speech sound okay, or is it slurred or strange words, or just doesn't sound right? If you see any of these signs, you're going to want to call 911 right away. Again, this is an urgent situation. Any time without treatment is time that the brain tissue can can die. Treatment for strokes, the ischemic stroke, and this is the one where the clot or the blood vessel is clogged and blood cannot get to the tissues of the brain. Within a certain amount of time, 4 to 4.5 hours, if the patient can get to treatment, and there are some other criteria they have to meet, but should they meet the criteria and get to help within 4 to 4.5 hours, these patients can receive TPA. TPA is a clot buster, and it works by dissolving the clot, and by dissolving the clot, the blood flow is improved and restored to the part of the brain that didn't initially get enough. That's just an example of why it's very important to identify a stroke quickly. For the hemorrhagic stroke, and that's the stroke caused by a burst blood vessel and bleeding, the treatment is initially just to find the cause of the bleeding and control the bleeding. If there is a potential for bleeding, say a patient has an aneurysm and the physician is worried about it, then there is an endovascular procedure that can be done much like a cardiac catheter is done to look at the heart. But a mechanical agent that's shaped like a coil can be introduced into that catheter and fed to the aneurysm area and will somehow stop bleeding and help with clotting. Risk factors for stroke. There are several things that you can change and several things that you cannot change. Things that you can't change is your age, your gender, your race, and your genetics or your family history. Things that you can have some more control over to help prevent stroke symptoms is high blood pressure, high cholesterol, heart disease, diabetes, diet, physical inactivity, and obesity. Stroke prevention, there's another little ABCs of heart and brain health. A is for aspirin. Aspirin can help reduce your risk for a stroke, but before you take aspirin, you need to make sure to check with your doctor. Sometimes aspirin is not good for everybody to take daily. B is blood pressure. You're going to want to control your blood pressure. Make healthy lifestyle changes and choices. Make sure that you take your blood pressure medicine if it's been prescribed. C is cholesterol. Cholesterol, to lower your cholesterol, you're going to want to manage your cholesterol with a low-fat diet, exercise, take any medicine as prescribed. And smoking, don't start smoking now, but if you already smoke, make every effort to quit. Lifestyle changes to help you prevent a stroke include eating healthy. That's, for instance, choosing healthy foods with less salt to lower your blood pressure, foods that are rich in fiber and whole grains, and that helps manage your cholesterol. And just getting regular physical activity. We're going to go over the pretest again. Another name for a mini stroke is a transient ischemic attack, or a TIA. The types of strokes are D, ischemic and hemorrhagic. What can result from a stroke is D, all of the above. The acronym to help remember the signs of a stroke is FAST, B. Which of these is a non-modifiable risk of stroke? That's A, your race. Strokes are caused by C, both A and B, blood clots and rupture of a major artery. 7, the most appropriate response to a possible stroke is D, call 911. 8, blank is another name for a stroke, and that is a cerebrovascular accident. Number 9, an ischemic stroke is caused by C, a blood clot in a blood vessel of the brain. Number 10, how long does it take to recover after a stroke? It could be days, weeks, or months to recover. My references for this presentation, and I'd like to